Hi, Dr. Arturo Bonilla from the Microtia Congenital Ear Deformity Institute. Today I'm going to be talking about a topic that many parents always ask me about. Who are all the specialists? There are pediatricians, family practice doctors, ENT doctors, audiologists. Who is everybody, and what do they do? Well, where do they come in and play to this big orchestra of specialists that we have when dealing with a little child with microtia? So I'm going to give you a short little lecture about who these are and what these specialties are and what they do. Let's start from the very beginning. Well, of course, nobody ever expected to have a child with a microtia. So usually when the mom goes and sees the obstetrics, the gynecologist doctor, they get the typical ultrasounds, things that we all expect, and nobody's really ever expecting to have any problems. Of course, when they look at the ultrasound, they're looking for the heart, the liver, the lungs, the brain. They're not really so much focusing or concentrating on the ear. So it's always a shocker when this happens. And many times during the delivery, many people don't even notice it until later on. There are different kinds of ultrasounds, and sometimes we can actually catch one through the 3D, 4D ultrasound. So kind of unusual that happens, but in general, nobody's really looking for any ear deformity during these ultrasounds. So once during childbirth, now you have the obstetrics, the gynecologist that delivers the baby, and their job is to deliver the baby, and they pass them off. They need their priority, of course, is the mom there. They usually have the other doctors, whether it's a neonatologist or any of the other doctors specializing in pediatrics that are there in case they needed something. So they usually hand the child off, and that's it. And the norm is once the either at that time or a little bit later, somebody notices that there may be a little deformity of the ear, because the ears are so teeny, of course, when the children are born, that they don't really notice it that much. And then they realize as they're looking things over that one ear may be bigger or smaller than the other one. Sometimes there are certain obvious ones when a child has a syndrome or things like that, but in general that's not noticed because it's usually on one side. So now that the children are born, mom is now in the patient room, and who comes into play now? Well, usually, if it's a typical delivery, the baby goes to the newborn nursery. Inside the newborn nursery, that's where the kids get their little hearing tests, their universal hearing screening that they get. The pediatrician or the family practice doctor kind of come in, and they evaluate the child. And that's the norm. And now they find something, or when they do find something, as far as I'm concerned, being a microtia surgeon, that's the perfect time for them to call us so that we can come in there, we can let the parents know that things are going to be okay. It's not the end of the world. It's pretty traumatic because the first things, like I've given in lectures before, that parents think of, oh my gosh, what did we do wrong during the pregnancy? Did we do this? Did we do that? Should we not have done this? Did we cause this? There's always a guilt issue going on. It's important for us to get to the parents right away and tell them this is not your fault. This kind of just happens. So once we find out that the child has a microtia and an atresia, which is no ear canal, sometimes the docs will consult a geneticist. And I'm going to talk a little bit about what a geneticist is, and you can see right here. Pediatric geneticists are physicians who are trained to identify the causes and natural history of malformations such as microtia and atresia. They also may suggest tests and treatments that can help in understanding and caring for your child's condition. They can help families understand whether some conditions are hereditary, in other words, coming from the genes, and they can also offer testing to family members who may be at risk for having children with similar conditions. So basically they come in, they talk to the families, they ask you about family history, they ask you all these questions about other family members if they've had issues with microtia, and they'll try to figure things out and hopefully give you percentages and risks of future generations. Now, before the child leaves the hospital, they usually, after they do the hearing screening, they'll check the kidneys, because the kidneys and the ears form around the same time. So they want to make sure that the kidneys are good, and that in general is pretty much it there at the hospital. If a child is born with something a little bit more severe, then, for example, there are certain syndromes, severe hemifacial microsomia or Treacher-Collins syndrome, where there's a lot of craniofacial abnormalities. Then sometimes before they go home, they may be actually admitted to the neonatal intensive care unit, and that's where the neonatologist, which is another specialist, is there. They're in charge of the acutely ill children. If it's a potential airway problem because the jaw may be small in one of these syndromic kids, then they consult maybe the craniofacial team to come in, maybe an oral surgeon, something like that, so that they can evaluate the child and make sure the child is healthy and has a safe airway and can eat okay before they send the child home. So that happens there during the hospital if the kids have a little bit more of an issue with craniofacial abnormalities. And I'll talk to you about each specialty there as well. So once the child goes home, now we're in a separate category because now the kids are stable, and the main people that take care of the child, we call them the gatekeepers, are usually the pediatricians or the family practice physicians, the family physicians. They're the ones that usually send the kids off to the specialists as they need it. So that's really, really important. Again, hopefully they've already spoken to the parents have already spoken to the Microtia specialist, so we can kind of be part of the team early on. The last thing we ever want to do as Microtia surgeons is to be consulted when the kids are 5 or 6 years old and they're ready for any kind of intervention if we get to that point. In general, we would like to be involved early on. And that way we can always be discussing with the pediatricians and their family practice, family physicians, so that we can have a pretty stable management plan. Once they go home, then it's important that the kids have another specialized hearing test called an ABR, auditory brainstem response testing. And the reason that is they don't get a typical hearing test where the child lifts the hand up, I can hear out of my right ear, I can hear out of my left ear. They're too little for that. So we have to do a specialized test where the computer kind of picks up on the brainstem activity and lets us know what the hearing is. Usually we try to do that the first maybe 3 to 6 months. I know it varies. Some people try to do it in 1 or 2 months, and some people wait until the 4 or 5 months. Of course, if the child is affected only on one side and we know that they pass the hearing screening on the normal ear, then it's not as much of an emergency, but we still try to get that in. So once they get sent for that, here's a whole different set of doctors. Okay, now you have an audiologist, you have we call otorhinolaryngologist or ENT doctor, and within that spectrum of ENT doctors, you have a general ENT, you have a pediatric ENT that specializes just in children, and then you have a neurologist, and those doctors are more basic skull surgeons, and they're usually the ones that actually perform the ear canal surgery if it gets to that point, if these kids are candidates. So usually an audiologist is usually found inside of an ENT doctor's office. An audiologist has a master's in audiology. They do all this. They're specialists in hearing tests, and they perform the ABRs, and then those results get sent off to the ENT doctors or pediatric ENT doctors or neurologists. But they all fall into the same spectrum. So from the time the child is home until the child now is old enough, if they choose to go through a surgical intervention, then you have the pediatrician, you have the audiologist, which are really, really important, and you have the Microtia surgeon, and you also have either the neurologist or the ENT doctor that specializes in following the child's hearing throughout the first several years. And as long as you follow up with that, then the kids are pretty safe. I mean, what we don't want to lose, what we don't want to do is have a child get lost through the cracks. All the doctors are extremely busy, so I always say the most important specialist out of all this is you, the parents. You kind of know who everybody is now, and make sure that the pediatrician sees the child. If there's a little ear infection, you go right away to the doc because usually they're affected on one side. You want to make sure that normal side stays normal. And then if there's a concern, then at least you know kind of who all these specialists are. And as I showed you previously, it's a big spectrum of specialists that are around for a child with Microtia, and it may seem like there's a lot of them, but there's not really. There's several specialists that are just in charge of this, maybe 3 to 4 specialists throughout the whole course, and it's important to follow up with all of these doctors or these specialists. That way, you'll know exactly where you are. The last thing we ever want, especially as a parent, is to have all these questions and not have these questions answered. So that's what we are here for. And if you ever have any questions, any doubts, always consult the specialist, because that's what we're here for. I hope this helped you. If you have any questions, of course, you can always let us know. Talk to you soon. Thanks.